Alzheimer's disease and dementia are the most feared diseases in retirees, even greater than cancer, stroke, and heart disease. Knowing your level of a blood test called neurofilament light, and more importantly, what you can do to lower your level, may be the most important thing you can do to decrease your chances of getting Alzheimer's disease or another form of dementia. I'm Dr. Tom Gattuso, professor of neurology and movement disorder neurologist. There's a good reason that Alzheimer's dementia is the most feared disease in people over 65 years old. Alzheimer's is a devastating disease that robs people of their memories and their independence and is the most common reason for nursing home placement. And the numbers are downright scary with aging. About a third of people over 65 either already have dementia or a common precursor to dementia called mild cognitive impairment, with the number increasing to almost 50% for those over 80 years old. So what can you do to assess and, more importantly, reduce your risk? Because Alzheimer's disease and other forms of dementia are caused by accelerated brain cell death that starts many years, even decades, before a person is actually diagnosed, protecting brain cells from dying is the key to preserving cognitive function with aging and preventing Alzheimer's disease. Fortunately, there is a blood test your doctor can order that objectively measures brain cell damage and death. The blood test is called neurofilament light, or NfL for short. If your blood NfL level is too high for your age, you're at higher risk for developing Alzheimer's disease, another form of dementia, as well as gait and balance disorders such as Parkinson's disease. You can see in this figure that blood NfL levels continuously increase from the age of 25 to about 55 years old. After 55, blood NfL starts to rise at a much faster rate, and after 65 years old, it really shoots up, reflecting accelerated brain cell damage and death. Because this accelerated neurodegeneration after the age of 55 reflects an increasing risk for Alzheimer's and Parkinson's disease, as well as an age-associated decline in memory and balance, keeping your blood NfL level as low as possible at any age would reflect preserved brain health and function and likely a reduced risk for developing these dreaded conditions. And if your blood NfL level is too high for your age, you're at even greater risk. Normal blood NfL levels broken down by age group can be seen in this table. If your blood NfL is higher than the average listed for your age group, you likely have accelerated brain cell death and would especially benefit from a blood NfL lowering neuroprotective therapy. It's important to understand that the values listed in this table and the previous figure were obtained using a gold standard assay called the Simoa assay that is currently only offered by the commercial laboratory Lucent Diagnostics. You can learn more about this assay and the laboratory by clicking the link that appeared above or the link in the below description. So how can you lower your blood NfL? In other videos on this channel, I've reviewed our clinical trial results showing that therapy with a dietary supplement called lithium aspartate was associated with a statistically significant reduction in blood NfL in patients with Parkinson's disease. This is a novel and exciting finding that we are continuing to explore in our clinical trials. Other videos on this channel have reviewed the best lithium aspartate dosage to take and how lithium aspartate therapy should be monitored by your doctor. Click the like and subscribe buttons below to easily access these videos. It's also important to understand that lithium aspartate or any neuroprotective therapy will not make you feel better or improve memory, balance, or any other symptom in the short term. Protecting brain cells from dying provides long-term benefit by preventing the onset or slowing the worsening of memory or balance problems. Healthy brain aging is all about protection and prevention. There's a saying in neurology, time is brain. Once brain cells have died, there is no bringing them back. With the accelerated brain cell death that happens in all of us, especially after the age of 55, It's only a matter of time before concerning symptoms like forgetfulness and gait imbalance appear in us all. Because brain cells very rarely regenerate, neuroprotection is the key to preserving brain health with aging, preserving memory, gait, and balance function, and preventing and slowing Alzheimer's and Parkinson's disease. And remember, a great way to protect your brain is to exercise every day.